In this part 2 of environmental pathology, we will look into the effects of tobacco, alcohol, and common drugs of abuse. Tobacco is the most common exogenous cause of human cancer. Smoking is the most readily preventable cause of human death, and it contains a mixture of 7,000 chemicals, with more than 60 of them are carcinogens. Carcinogen to the lung, for example, polycyclic aromatic hydrocarbons, carcinogen for the esophagus, N and N, pancreas, NNK, bladder, naphthylamine, oral cavity polycyclic aromatic hydrocarbons, and oral cavity NNK and NNN. About 75% of non-smokers are alive at the age of 70, and only about 50% of smokers survive to the age of 70. Smoking is associated with many types of cancer, such as the lips, oral cavity and pharynx, esophagus, stomach, colorectum, liver, pancreas, larynx, trachea, lung and bronchus, cervix, bladder, kidney, and acute myeloid leukemia. There are many effects of smoking on lung, the heart, and the GIT. The polycyclic hydrocarbons and nitrosamines are potent carcinogens, and they are involved in the development of lung cancer. There are irritants to the mucosa of the lung that can produce bronchitis. The cigarette smoke also causes recruitment of leukocytes, and that can cause increased elastase production, which can lead to emphysema. In the heart, cigarette smoking is associated with atherosclerosis and the major complications such as myocardial infarction and stroke. In the GIT, this is a most important cause of oral cancers, and it is associated with the risk of oral, laryngeal, esophageal cancer, and also peptic ulcers. Smoking also can cause fetal hypoxia, low birth weight, prematurity, and increased spontaneous abortion. Birth weights of infants born to mothers who stop smoking before pregnancy are, however, normal. Secondhand smoking is associated with increased risk for myocardial infarction, lung cancer, ischemic heart disease, and sudden infant death syndrome in maternal smoking. Children living in a household with an adult who smokes have increased risk for respiratory illnesses such as asthma. There has been an increase in the use of electronic cigarettes in the past decade, especially among school students. The impact is still to be determined. However, the cigarette smokers may become dual users of cigarette and electronic cigarettes rather than quitting smoking. Young people who become addicted to nicotine via the electronic cigarettes may switch to cigarettes. Alcohol is the most widely abused agent. Metabolism of alcohol is directly responsible for its toxic effects. Most alcohol is transformed to acetaldehyde in the liver by three enzyme systems, which is alcohol dehydrogenase, the microsomal ethanol oxidizing system, or cytochrome P450, and catalase. The main enzyme is ADH, located in the cytosol of hepatocytes. At high blood alcohol levels, the cytochrome P450 participates in its metabolism. Induction of the cytochrome P450 by alcohol explains the increased susceptibility of alcoholics to other compounds. Acetaldehyde, the direct product of alcohol oxidation, has many toxic effects and is responsible for some of the acute effects of alcohol. The efficiency of alcohol metabolism depends on the expression levels of alcohol dehydrogenase and aldehyde dehydrogenase, as well as genetic variants that alter enzyme activity. 50% of Asians have very low aldehyde dehydrogenase activity due to the substitution of lysine for glutamine. Individuals with inactive ALDH22 variant are unable to oxidize acetaldehyde and cannot tolerate alcohol experiencing nausea, flushing, tachycardia, and hyperventilation after its ingestion. Alcohol oxidation by ADH causes the reduction of nicotinamide adenine dinucleotide NAD to NADH, and this decreases the NAD and increases the NADH level. NAD is required for fatty acid oxidation in the liver. This deficiency leads to accumulation of fat in the liver of alcoholics, called fatty liver. Metabolism of ethanol by cytochrome P450 produces reactive oxygen species, and this can lead to lipid peroxidation of cell membranes that leads to hepatic injury, acute hepatitis, and that can eventually cause alcoholic cirrhosis and hepatocellular carcinoma. Chronic alcoholics can substitute alcohol for other food, and that can drastically reduce their food intake. This can lead to multiple vitamin deficiencies, especially thiamine deficiency, which can lead to Wernicke syndrome and Korsakoff syndrome. In the CNS, alcohol is a depressant, first affecting subcortical structures. At higher blood levels of alcohol, cortical neurons and medullary centers are depressed, including the respiration center, which could lead to respiratory arrest. Alcohol effects on other systems include dilated cardiomyopathy, hypertension, acute gastritis, pancreatitis, rhabdomyolysis, testicular atrophy, and spontaneous abortion. Another effect of alcohol is fetal alcohol syndrome. The consumption during the first trimester of pregnancy is particularly harmful. Fetal alcohol syndrome is characterized by growth and developmental defect, facial dysmorphology, and malformation of the CNS, CVS, and genitourinary system. Alcohol consumption has been found to be associated with the development of many cancers, including oral cavity cancers, oropharynx, hypopharynx, esophagus, colon, rectum, liver, female breast, intrahepatic bile duct, and larynx. The culprit is acetaldehyde. The body cannot convert the acetaldehyde fast enough, so it builds up and causes irreversible DNA damage that can lead to cancer. Next, we look at common drug of abuse, which includes cocaine, heroin, and amphetamines. Cocaine is one of the most addictive drugs, and it is often inhaled rather than injected. It inhibits reuptake of neurotransmitters dopamine and norepinephrine. The net effect are excess stimulation manifested by tachycardia, hypertension, and peripheral vasoconstriction. Cocaine induces myocardial ischemia by causing coronary artery vasoconstriction and by enhancing platelet aggregation and thrombus formation. This increases myocardial oxygen demand and decreases coronary blood flow. Overdose can produce seizures, cardiac arrhythmias, and respiratory arrest. Atherosclerosis can also occur in chronic use of cocaine. Heroin is usually self-administered intravenously or subcutaneously. Usually, the injection is not done in aseptic condition, hence infection complications are common. Common sites of infection are the skin, subcutaneous tissue, heart valves, liver, and lungs. In the heart, right-sided heart valves endocarditis can occur, especially in the tricuspid valve, and this can be caused from Staph aureus from the skin. Viral hepatitis and HIV is acquired by sharing of dirty needles. Sudden death, usually related to overdose, is due to addition of very potent synthetic opioids. One of the examples of amphetamine is ecstasy. It acts by releasing dopamine in the brain, which inhibits presynaptic neurotransmission at the corticostriatal synapse, slowing glutamate release. This produces a feeling of euphoria, which is followed by a crash or withdrawal syndrome. Long-term use leads to violent behaviors, confusion, and psychosis, marked by paranoia and hallucination. Adverse effects of amphetamine include excess sweating, muscle contraction that can lead to hypothermia, organ failure, and death.